It's 6:15.
Dr. Deeksha, will you give the introduction?
Yes. Sorry?
Yeah.
The introduction. Oh, yeah, sorry. Okay, I spoke so much already. All right. So, good evening and welcome everyone to today's session, our magnum opus, that is Miasms. So, one of the most important and one of the most crucial topics of homeopathic philosophy and homeopathic practice itself is the topic of miasms. And it was introduced to us by Dr. Hahnemann himself, who, after many years, realized that there was some deeper cause to chronic diseases. And without any further delay, let us proceed to the introduction, general interpretation and introduction to miasms. We are not dealing with individual miasms today. We will deal with each one on a separate session, and it's so that we can all approach it in detail and we can clear whatever questions we have. And if there's any difficulty, any discrepancy in the sound and the connection, please bear with us. We will make sure that we repeat everything for you, and we clear everything out for you. So just sit back and listen to today's presentation. It's a very nice, very short presentation, but very informative. So all of you, yeah, get ready. Sujata, you can start.
Okay, ma'am.
Yeah. Just talk a little louder and clearer, okay? We can hear you then.
Okay, ma'am. Okay.
All right, you're clear. You can start.
A very good evening to everyone. So, like you all know about today's topic, that is about miasms, and it is the most requested one, and it is one of the most important topic in homeopathy. So, today we will discuss about a general interpretation about miasm, like what is the concept of miasms and everything. So first, whenever we heard about the word miasms, three things comes to our mind, that sora, syphilis, and psychosis. But that is not everything about miasms. That is just the types of chronic miasms. But the concept of miasm is more than that. So today we'll deal with the general interpretation about miasms. So first, we'll discuss about how this concept of miasm originated. So Hahnemann discovered homeopathy after discovering homeopathy and practicing homeopathy for 30 years. So during that time in homeopathy, there is no concept of miasms. But after discovering it and practicing it for about 30 years, he came to a fact that the non-venereal chronic diseases, after being removed homeopathically by the remedies fully proved up to his time, always returned in a more or less varied form and with new symptoms, or reappeared annually with an increase of complaints. So, in chronic diseases, after treating it with most suitable homeopathic medicine, it gets cured, but there is no complete cure. It returned annually and appeared with some new set of symptoms or some increase of complaints. Whereas in the acute diseases, applying of homeopathic remedies, it gets cured speedily and completely by means of a correct application of homeopathic remedies. So why this is the acute diseases are cured, but why not chronic diseases are curing completely? So then a question comes to Hahnemann's mind, that now the question arises, why the vital force cannot produce any true and lasting recovery in these chronic diseases, which it produced in acute diseases and cured it completely, but why not in chronic diseases, even with the aid of the homeopathic medicines, which best cover their present symptoms? So then, to this question, Hahnemann thought of about the five reasons. Maybe those are the reasons behind that prevents the complete recovery of chronic diseases. So now Hahnemann thought about some reasons behind these reoccurrence of chronic diseases. The first thing is that maybe the law of similia may not be applicable universally. inadequate number of proved homeopathic medicines to cover the different types of human diseases. The third thing is that maybe there is some defect in application of law of similia, or maybe there is some defect in ascertaining the totality of symptoms, or maybe there is presence of some serious obstacles to cure that is overlooked. So these five things comes to Hanniman's mind after that question. So he inquired further based on these 5 points. So about the first point, he give the description that the law of similia is based on several observations and experiments, and also this was observed to be followed by nature herself to bring about cure of natural diseases. So the law of similia is universally applicable. And the second point, even new addition of proved medicines have not advanced the healing of chronic diseases. So there is some new medicines are getting added into the homeopathic medicines list, which fully proved. But it cured the acute cases, it cures the chronic cases, but why not completely curing the cases? So this may not be the reason, because we have medicines that cure the diseases, but why not in chronic diseases it advance the healing, it advance the complete cure. So then the
Sujata,
third point.
Sujata, 1 second. Can you, if you don't mind, hold your microphone a little closer? Because some people are saying your sound is not audible.
Okay, ma'am.
Yeah, I can hear you. I think it's not clear for some other people.
Yeah, ma'am. Okay.
Yeah. You just hold the microphone a little closer to your mouth. That's all.
Yeah, ma'am.
Yeah.
So the third and fourth
Yeah,
point is
carry on.
that, so the third and fourth reason gave him the first clue. So the third reason is that the law of similia may not be applicable in a correct way, and the fourth reason is that there may be we are not getting the totality of symptoms, the complete totality of symptoms. So that three and four reason, the third and fourth reason gave him the first clue that the diseases presented before the eyes of homeopathic physician is not well defined diseases. So the symptoms that are presented in front of the homeopathic physician is not well defined. That is not the true totality of the disease. So physician has to investigate about more deep-seated original disease in order to cure it speedily and permanently. So physician must first find out, as far as possible, the whole extent of all the accidents and symptoms belonging to the unknown primitive malady before he can hope to discover one or more medicine which may homeopathically cover the whole of the original disease by means of its peculiar symptoms. Okay, so first we have to clearly investigate the case. There may be something deep-seated reasons that is not showing to us, that is hidden, and we have to investigate the complete totality of disease. And after that, we can apply the law of similia in a perfect way. After, if we get a true picture of a disease, then we can choose a true drug picture from our macromedica, that is the true medicine, the perfect medicine for that disease. So we have to take the totality of symptoms thoroughly. We have to investigate that deep-seated reason, that deep-seated symptoms that is hidden. So we have to investigate all of this thoroughly, and after that we can apply the law of similia in a perfect way. So this is the third and fourth reason that gives him the first clue, and then the fifth reason. So here is a graph. I just got it from Organo of Medicine book by Dr. G. Nagendra Babu. And here is the from this graph we are getting that this is the presenting complaint that is visible to us, that is the visible disease that is presented to us by the patient. But there is some symptoms, there is a huge deep seated reason, a huge deep seated cause, that is the dormant, that is the unknown thing, that is the unknown primitive malady, that is the fundamental cause, that is the true totality in chronic cases that is hidden to us. So we have to investigate that things. Investigation of constitutional totality of symptoms in chronic cases introduced into homeopathy after the theory of chronic diseases. So this is the first clue towards the origin of miasms. Okay. Now the second clue, that is the fifth reason. The fifth reason is that there is some obstacles to cure which is overlooked. So here comes the second and most important clue that led to origin of miasms. There is some obstacle which after it has once advanced and developed to a certain degree, that obstacle is getting advanced day by day, gradually it gets advanced and it developed to a certain degree. It can never be removed by the strength of any robust constitution or can never be overcome by the most wholesome diet and order of life, nor will die out itself. So that is the obstacle that is once developed, that is getting developed day by day. But once it reached that certain degree, developed to that certain degree, can never be removed by the strength of any robust constitution or can never be overcome by the most wholesome diet and order of life, and it will not remove by itself as well. So this is the obstacle. This is the main obstacle which prevents complete cure of chronic diseases. So this is the main hidden thing, that this is the main deep-seated cause that we are missing in the totality of symptoms in chronic cases, and that is the most obstacle, that is the most important obstacles that prevents the complete cure of chronic diseases. That's why the chronic diseases gets cured and appeared again annually, and it reoccur again and again and not get completely cured. So these are the things, these are the points, these are the two clues that um, based on that the miasm theory originated, the concept of miasm originated. So by definition we all know that miasms are dynamic disease producing power which pollutes the human organism. So miasms pollutes the human organism and become the producer of every possible disease condition. So this is the main cause. This is the deep-seated hidden thing that is not. We have to investigate to get that the concept of the miasms. That is the most important cause that is hidden, and that is the obstacles to cure. So it pollutes the human organism and it's developing gradually and become the producer of every possible disease condition. So the word miasm comes from a Greek word miasma. So the word miasma is already present, already using before anyone described the concept of miasms. So during that time, what is the meaning of this word miasma? So during that time, the word miasma which means polluting exhalation, malarial poisons, morbific emanations from putrescent organic matter, animal or vegetable, euplavia arising from the bodies of those affected by certain diseases, some of which were regarded as infectious and others not. So this is the meaning, this is the different meanings, that is before the Hahnemann gives the concept of miasms, the word miasma literally means these things. But Hahnemann, but according to Hahnemann, Miasm means a chronic syndrome, that is, a combination of signs and symptoms associated with a morbid process. We all know that diseased condition is a process, especially in chronic diseases, it is a process. After it started, then the sign and symptoms changes and aggravates, ameliorates, and this is a process. So miasms are the chronic syndromes. That is the main cause, and that is syndrome means the combination of various diseases. So here the syndrome means the combination of signs and symptoms that is associated with that morbid process, that disease process, that chronic disease process. So that is the miasm. Stuart Close remarks in his Genius of Homeopathy, a miasm, according to Hahnemann and to most of his followers, an infecting agent and a cause of disease. So it is the same thing that this is the deep-seated cause, this is the obstacles to cure. So this is the main reason why the chronic diseases are not getting cured by the best selected homeopathic medicines, and it reappeared again and again. So any miasm, so Hahnemann describes further about miasms that any miasm, including both acute diseases as well as chronic miasmatic diseases. So miasms can be present, can be the main cause of acute illnesses as well as the chronic miasmatic diseases. Develops in the following three movements. So there is three movements by which the miasm is developed gradually inside the organism. So the first thing is that the time of infection. And the second thing is that the period of time during which the whole organism is being penetrated by the infection until it developed fully within. So the time of infection, the miasms can be inherited and can be acquired. So that's why that is the time of infection. And then the second thing is that the period of time during which the whole organism has been penetrated, the miasm are getting developed. The miasm is getting developed within inside the body. And the third point is that the third movement is that the breaking out of the external element, whereby nature externally demonstrates the completion of internal development of the miasmatic malady throughout the whole organism. So the miasm once get fully developed, reach that certain point, it shows the external complaints. It shows that the miasm is developed and it breaks out through external elements. So this is the three movements: the time of infection, the period of time during which it penetrated, developed, developing gradually, and after that it developed and shows the external complaints. And through those external complaints, we know that this person is suffering from this miasm, maybe the reason and everything. So this is the three movements. But the infection with both acute and chronic miasms takes place without doubt in one single moment, and that moment is the most favorable one for infection. Some pioneers of homeopathy and followers of Hahnemann like Stuart Close, Burnett, Clark, Taylor, etc. believes that this miasmatic theory is somewhat relatable to the modern terms of bacteriology. They believe that some of the pioneers believe that it somewhat relatable to the modern terms of bacteriology, because Hahnemann in his book Chronic Diseases describes about this word, that parasitical nature of infectious diseases, example smallpox, chickenpox, measles, scarlet fever, cholera, etc. So that's why some of the pioneers related this to the modern terms of bacteriology, because it also has that 3 points of infection. In bacteriology, we have the incubation period, and after that, the breaking out of symptoms. So everything. So based on that concept, they think that it is somewhat relatable to bacteriology. But I will not go deep into that, because I don't think that it is relatable to bacteriology, because during Hahnemann's time, he don't have the the theory of this parasites, bacteria, even not the microscopes, etc. So still he gets that something the hidden reason behind this type of diseases. That's why in chronic diseases especially, that's why it is not getting cured completely. So it is a completely different theory, and it is not relatable to bacteriology. So I will not go deep into that. So now we know that how the concept of miasm originated, and what is its definition, and some important points about the miasms, and then we'll discuss about the types. So miasms are four types: acute miasms, half acute miasms, accessory miasms, and chronic miasms. So first we'll discuss about the acute miasms. It is a dynamic disease causing agent. By the definition, we know that miasm is a dynamic disease causing agent. So in acute miasm, it causes acute, specific, infectious diseases having almost fixed manifestation. It has a fixed manifestation, means Kane defines it as an acute miasm is one that comes upon the economy, passes through its regular prodromal period, longer or shorter. It has a fixed period and has its period of progress and period of decline, in which there is a tendency to recovery. So acute miasm has a fixed manifestation. It infects the body, it gets developed, shows its signs and symptoms, progress, decline, and but it has the tendency to recovery. The patient can recover from that acute miasm. So that is the acute miasm. Acute miasm is further divided into two types: recurring type and non-recurring type, or fixed. So first, the recurring type. Recurring acute miasm means it reoccurs in the same manner more than once in a lifetime of a particular person. Example: Asiatica cholera, plague of Levant, yellow fever of the seacoast, etc. So this is the recurrent acute miasm that reoccur in the same manner more than once in a lifetime of a particular person. Then the non-recurring type, or the fixed acute miasm, that is, it attacks persons once in a lifetime. Example: the smallpox, whooping cough, etc. These are attacks a particular person once in a lifetime. So that's why it is the non-recurring type, or the fixed miasm, fixed acute miasm. So this acute miasm, so this under this acute miasm, Hahnemann describes about a subtopic, that is subtype, that is the hap spiritual miasm. The miasm of measles, scarlet fever, and pox, that is, he called that the hap spiritual miasm. So after completing this hap spiritual miasm, after completing their parasitical existence in the system for some time, they die out, leaving the organism to recover soon if the patient does not die by that time. So in acute miasm, it has a tendency to recovery. But here in half spiritual miasm, during its when it is present inside the body, it is so severe. It will break out so severe that the patient may get serious, or may get maybe died. So here the half spiritual miasm means after completing their parasitical existence in the system for some time, they die out. They leave the body to recover if the patient does not die by that time. So this half spiritual miasm have a peculiar characteristic. After they have penetrated the vital force in the first movement of the contagion, and each of its own way has produced disease, and then like parasites have quickly grown up within it and have usually developed themselves by their peculiar fever after producing their fruit, the mature cutaneous eruption, which is again capable of producing its miasms. They again die out and leaving the organism again free to recovery. So now the second type, that is the half acute miasm. Half acute miasm is the miasm of rabies or hydrophobia. So this miasm has taken effect in the moment when the person was bitten by a mad dog. Poison has then communicated. So taken effect in the moment when the person was bitten by a mad dog. That is the moment of infection. That is the particular moment when this miasm gets inside the body. Poison has then communicated itself to the nearest nerves, and as soon as the malady has been developed in the whole organism, for this development and completion of disease, nature requires at least several days, often many weeks. The madness breaks out as an acute, quickly fatal disease. So the difference between acute and half acute miasm is that in acute miasm there is a tendency to recovery. That miasm will free the organism to get recovered. But in half acute miasm, that is the miasm of hydrophobia, it will not recover. It has its time of development and completion. It takes several days, but it will break out. It will cause fatal to that organism. So that is the difference between acute and the half acute miasm. Even the immediate excision and amputation of the infected part does not protect from the progression of the disease within, nor from the breaking out of hydrophobia. So that is the important thing about the half acute miasm. It will break out. Cleansing, cauterizing, and suppurating the wound can protect a little, but it will break out. Accessory miasm. Apart from the protective matter, the lymph of inoculated cowpox contains an additional miasm by which it produces a characteristic cutaneous eruption on the skin. This additional miasm Hahnemann called the accessory miasm. Lymph of inoculated cowpox, besides the protective matter, contains a contagion capable of producing a general cutaneous eruption of different nature. It consists of small dry pimples resting on a small red areola, frequently intermingled with red cutaneous spot and accompanied by most violent itching. By the similarity of this accessory miasm, the inoculated cowpox cures perfectly and permanently in a homeopathic manner similar cutaneous eruptions of children, often of very long-standing and of very troublesome character. Now comes the chronic miasm. So chronic miasm is the fundamental cause of all type of diseases. It produces the true natural miasmatic chronic diseases. It predisposes human beings to various types of acute diseases. And chronic miasms go on worsening inside the organism in spite of the best corporeal and mental regimen, and it torments the patient till the end of his life because it is ineradicable by the vital force alone without the aid of the dynamic homeopathic medicines. And this chronic miasm have the tendency to transfer from one generation to the other. That is why in chronic cases we ask about the family history, because if a person having a continuous cough, we a chronic type of cough, we asked him about if in their family someone having already had some tuberculosis. So that's why we asked, because this chronic miasm transfer from one generation to the other, and it predisposes that organism, and it is inherited. Like I previously mentioned that the miasms can be inherited and can be acquired. So in these cases, when we ask the family history, because maybe that miasm is inherited by that person from his family. So chronic miasms is of three types we all know, that is psora, syphilis, and psychosis. So we will discuss about psora, syphilis, and psychosis in different classes. Each classes we will discuss about everything about psora, syphilis, and psychosis. So here is the conclusion that I understood about the miasms, that basically miasms are that causes, that monsters which is present in our bodies. It can be inherited or it can be acquired. For example, if I have a chronic headache problem, then that miasm inside me does not allow the body to recover fully. That is the main reason, that is the main cause, that is hidden, that is the deep seated cause. So whenever any exciting cause is there, it will make the headache worse and make the body more sticky. So after we cured that most trivial symptom, the most important symptom, the present complaint, then we have to cure and remove that miasm completely through the anti-miasmatic treatment to make the body recover fully and permanently. So that is it about the general interpretation of miasms. So thank you.
Thank you so much, Sujata. One second, I'll just check if Dr. Diksha is also joining us. Yeah, as yes, don't worry, Dr. Diksha. So as we already spoke in the beginning of the webinar, this this webinar was just the basic, or just the starting of what myasm is. So we will be talking in detail about psora, psychosis, and syphilis in the further coming webinars. This is just how it became, how miasms as a uh, concept came into the light, or how Dr. Henneman had brought miasm. How did he even think? Why did he even think of something? What triggered him to have to think about what miasm is, or what gave way to him? So that was all about today's webinar. So we will definitely talk about detail, but Sujata had really done a great job in explaining the introduction to us. Thank you so much, Sujata.
Hi, yeah, I'm
Yeah,
back.
Thank
So,
you,
yeah.
ma'am.
yeah, sorry, I had a power cut. Yeah. So, yes, that is very good information what
I'll
Sujata has
just
presented.
I'll
And
just
in case all of
finish.
you, yeah, yeah. No, no,
I
I
just
heard you. I
say
just couldn't connect my,
okay, good.
I heard you,
Okay,
I
good.
heard you. I couldn't
Great.
connect my audio and video. Okay. So, what happened is the reason that Sujata has presented all this extra information about the pox and all those things is because Hahnemann had come up with this conclusion way back in the late 1800s. Sorry, in the late 1700s. So he was born in 17 what? When was he born? 1753. Yeah, yeah. No, he was born in the 1700s and died in 1800s. So
Okay.
he nearly more than 60 years before Louis Pasteur came up. Yeah, 1755. Thanks. He died in 1843. So this is even say 30, 40 years before Louis Pasteur came to the conclusion that pathogens were responsible for causing diseases. And Hahnemann had come up with this groundwork even much before Louis Pasteur. He had not even used a microscope for all you know. So what happened is he used this theory of recurring diseases. to figure out and conclude that there was some disease agent called a miasm. He didn't know what it was. He could not infer, or he could not come to the conclusion, but he knew there was something inside deeper than just say an injury, or say, an external environmental stimulus that is causing a person to fall sick. And that is why he came about the term miasm. Then he started classifying it into acute and chronic. So acute miasms are all what Sujata presented, and we don't generally know about it. See, we didn't know about all this half acute and the hydrophobinum and the rabies and all. It's very interesting because it's through experience and through all these diseases that we conclude that they have these lasting effects on the body. It's not just one touch and go thing. Then he came to the conclusion that chronic diseases have chronic miasms. So it is something that is deeper than just one exposure. And then he came to the conclusion that there are three of chronic miasm: SORA, which is the dysfunction. So loss of function or altered function is the SORA. Then there is psychosis and syphilis, which are venereal diseases, STDs. The patient need not necessarily suffer an STD to have the psychotic or the syphilitic miasm. It's just that it has to run somewhere in the history of the patient's family. Even if his great grandfather had a severe attack of syphilis, it can be passed on to the next and next generation. So psychosis is considered excess or a sort of incoordination. For example, there is an excess of something in the body which is causing a sort of incoordination, imbalance in the functioning of the body. So it's not just a skin deep function, there is a structural change also. And in this structural change, you're not losing the structure, you're gaining something extra which is of no use to the body, which is only disease causing. So that's why in psychosis, you find tumors, you find a lot of dropsy, you find a lot of fluid collection, and also you find a certain excess, intense change in the mentality or the mental temperament of the patient. Syphilis is the final stage. Syphilis is very destructive in nature, irreversible structural changes, and you find that in syphilis, the disease itself. So there is discontinuity, there is ulcers, there is a loss of tissue, there is destruction of the tissue, which cannot be reversed. So this is how he concluded, saying that these are the three miasms. So everybody is born with a SORA because it's only loss of function. So somewhere it is always sitting inside your body, it's asleep. Suppose there is an external stimulus, external environment that is causing the breakout of SORA, then you will find loss of function. So is anything audible? Am I not audible?
Yeah, you are audible completely.
I'm audible. Okay, somebody is not able to hear me. Why don't you just refresh your screen? Sometimes the sound is lost because of that. Yeah. Yeah, Vaishnavi, please refresh your screen. Okay, I think you won't be able to hear me. No, let me just type it. Okay, I'll just type it down for her.
Huh. Voice is a little bit breaking, but just try to refresh. Yeah.
Yeah, just hold on. I had a power cut, so the generator is running in the background. Give me a second. It's raining heavily. It's not audible, huh? Give me a second.
Can you hear me? Is it just from your side or?
Okay. Am I audible?
I don't know who she's referring to, but yeah.
Okay. You can mention the name of the doctor down there. No. Okay, I'm audible. All right.
Both are audible.
So
Great.
no, I had a connection issue, I think, because I had a power cut. I hope I'm back online now properly. All right. Thank you. So, okay. So where did I stop? I said these are the chronic miasms, and everybody is born. Okay.
Okay, I'll share a fun story till Dr.
Hold
Diksha fixes or types. So
Okay,
after
let me
Henneman,
just refresh. I'm just refreshing my screen.
Yeah. Cool. Go ahead.
You can share the story. Carry on.
Yeah. So after Dr. Henneman had thought about the whole Miasm concept and he was going to publish the book. So naturally, he had kept it a secret from his disciples also, because he wanted to work on it and he wanted to, um, you know, be confirm on what he's, thinking about or what he's proving about, and then talk about it to the disciples. So more than 12 years, he had kept it a secret from his disciples. So after a stage when he said it's confirmed. He confirmed that there is a theory called miasms, or doctrine of miasms was a proved fact. Then he spoke to his disciples and he explained the whole theory, and he also told that he's going to publish about the doctrine of chronic miasms. After that, no one, there was a lot of criticism. There were a lot of criticism, because everyone thought that he's also falling into the trap of a modern, uh, that kind of a allopathic form, because he thought that there is something pathologically and there will be a miasm in everybody. But yes, Monica, we will get back to how we treat patients with miasms. So everybody all his disciples were again criticizing him and against the concept of miasms, because he said everyone will have an inherent miasm, and homeopathy is something where everyone's treated as an individual whole. So how can one say that only 3 miasms would be inherent, or a sora would be inherent in single uh, every individual? So everyone were against it, and later on, after proving, after treating diseases, and after having anti-miasmatic remedy, he brought in anti-miasmatic remedy. How an remedy, say for tuja, had been antipsychotic, how did it act? And then everybody came into a vision saying, okay, this is the concept. The doctrine of miasm is a real thing, and we have also faced the same problems in our practice also. Oh dear, I think this is, I can hear clearly. Okay, sorry. So how it is a concept, a doctrine of miasm. That is when doctrine of miasm came into light. And Dr. Diksha, are you joining in? Yeah.
Am I audible?
That is how he, after that, he had put in aphorism 78 in the Organon, I think the 5th edition of Organon. Sorry. The 3rd edition of Organon had miasms the first time, and that is how the whole concept of chronic miasms came into light.
Right. Yeah, it's a very interesting theory. And also, we must remember that in those days, when we're talking about the late 1700s, infectious diseases were more prominent. We didn't have lifestyle diseases so much. Allergies were not that prominent. Autoimmune diseases, not so much. Maybe they were there, but they were not discovered yet. So, when you have infections like tuberculosis, every alternate remedy that you read in your, I will, Surbi, I will, one after the other. So I was trying to reconnect my internet, that's why. So if you notice, every alternate remedy that you see in your Materia Medica, it will be the word phthisis will be written, PHTHISIS, phthisis. So in those days, infections were prominent. That's why STDs were prevalent, because there were no contraceptives, there was no birth control, there were no barriers. So it used to spread rapidly and it used to infect people. And treatment was very limited. They also had very primitive methods of treating. So it used to go very deep. So coming to your doubt, Surbi, how do we treat patients with miasms? We must understand that the manifestation of our drugs, especially the polycrests, are all matching the symptoms of our miasms. So if we can classify drugs based on their miasms, then you know what to expect. Like I said, every patient is born a SORA. Every patient will have dysfunction at some time in their life. Suddenly they'll catch a cold. Suddenly they will have some exposure to some external stimulus, have a cold, have a fever. That is a pure loss of function. Or suppose you go eat food outside and you have a stomach upset, vomiting and diarrhea. That is purely loss of function. It can be restored both either through, change in your diet or your regimen, or you can give a mild antisoric remedy, and that will bring the person back to their functioning state. So that is how SORA is manifested. Yes, I mean, SORA was developed because of the skin disease which is known to mankind since a very like thousands and thousands of years ago. But then it is purely loss of function. But if you let the complaint and if you let the exciting factor fester and if you let it, stagnate in the person without getting rid of that factor over a long period of time, then it can develop into the next miasm and miasm after that.
Yes.
So taking the history of the patient is very important. Find out about the family history, find out how to interpret miasm from the history given by the patient. So first of all, look at the manifestation of the complaints, whether it is tendency to allergies, tendency to inflammation, then that is functional. And suppose the inflammation is recurrent, suppose it is deeper, suppose there is a lot of fluid collection, there is an excess. So for example, like I said, psychosis, there is an excess of everything, a lot of discharge, a lot of growth, a lot of effusion, a lot of the dropsy, a lot of fluid collection. And at the same time the mental complaints where the patient has a lot of excess of everything. So excessive desires, excessive external. So psychosis is very very passionate and a very very what do you call, volatile in their manifestation.
Yes.
So their diseases and their symptoms will show externally. A syphilis is exact opposite. You'll suddenly find the patient has come with some deep ulcer, peptic ulcer,
Yeah.
some cancer which is not there before. So, and you had no idea. So then what happens is this is how you take the case, and nobody will ever start their disease with a psychotic or a syphilitic manifestation. It will only start with a SORA and it will go on to a syphilis. Okay, I will give you an example of a drug, and that will probably help you understand better. So if SORA is coming from skin complaints, and if we have any stomach complaints, and we all have skin complaints in our past, it's not like that. So SORA had a history. It is the way it was discovered was through skin complaints, the SORA itself or psoriasis. But what happens is it is symbolic of loss of function. It is not just skin. It can be loss of function of any organ. And so you can even treat it for loss of function or an altered function in the stomach complaints. It can be in the in the respiratory complaints, urinary complaints, something seasonal. So everybody is a SORA to start with. So if you give a SORIC remedy, the function can be restored. But suppose there is a structural change over a longer period of time, then you have to give a different remedy. You have to choose a different miasm. I'll come to that. I'll explain with the example of a drug so you'll understand. So, ma'am, stomach upset from some food is functional but acute complaint. Should we have to go for acute remedies? And why antisoric? Okay. Yes. So SORA is lack, psychosis is excess, and syphilis is destruction. Correct. So that's a very good way of interpreting and putting a theme to each mechanism. Yeah, Vidya, coming to your question. So stomach upset is acute. So correct. I mean, it is acute, isn't it? Like I said, SORA is there inside everybody. So every remedy will have a soric background. I'm not saying that it won't be there, but we don't have to take the miasm into consideration. You just treat it as an acute exacerbation. And you don't even have to worry about miasms when you're treating a stomach upset. You just have to take it according to symptom similarity. But suppose the person has repeated is psoriasis, SORA. Psoriasis was the disease that was prevalent from ancient times. I forgot which civilization. Was it Greek civilization? So psoriasis existed then. And then they noticed that the patients they were not able to treat psoriasis well because it's not much of a deep complaint. It is a superficial complaint, but it was spreading. There were scabs. It was falling off, and then they were able to say that yes, there is a loss of function, and then they named the miasm SORA after that. So psoriasis is a part of SORA. SORA is a miasm. Uh, SORA is like a what do you say, an overall
Basically,
totality of
what happens
soric.
is
Hmm.
when the person,
Go on.
every miasm has its own latent phase and a manifestive
Hmm.
phase. So what happens in the
Manifest.
latent phase? So what happens in the later? Everyone has SORA. In a child is inborn with SORA in its latent phase. So that is why we say that a person is having every child, every human being, every individual is in its soric state, but it would be in a latent phase. So the transition between the latent to a manifestive phase will have one cause, like that is why we say it's an exciting cause or a maintaining cause. Is it necessary to get born with psoric miasm? Every individual will have psoric miasm in their latent phase.
Yes.
So latent
It is
phase is
necessary to
something
get
which is
born.
inactive.
Yeah.
Sorry, I'm really sorry.
No, 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 no. Go on, go on, go on, go on.
Yeah,
Finish
so
your whatever you
latent phase is something which is in an inactive phase. So until unless there is a I can't say it's a trigger, it's an exciting factor which comes into play. That is when you have exciting factor. Could be anything from emotional disturbance to a loss or a separation of an near or dear one, or in physical fall or anything like that. Till then the sora will be in its latent phase, and once you have this
Mm.
exciting factor coming in, that is when the sora, after that a repeated disturbance or a maintaining cause will give lead to a manifestation or a aggressive phase of sora. Yes, doctor.
Right, right. Is it necessary to be born with psoric miasm? It's not necessary. You have no choice. You are born with it. What I'm saying is that psora it's a tendency. It's a tendency, and everybody can undergo loss of function at some point in their life. Even an infant will catch a cold at some point, isn't it? So then that is that is a loss of function, isn't it? But if this happens repeatedly, then you have to consider the miasmatic background. You might have to give a deep acting remedy. Otherwise, you can just give an allium cepa or a euphrasia and get done with it, isn't it? But if the child gets sick again and again and under a certain similar or the same set of conditions, then you have to say, okay, there is something deeper, there is something causing the excitation, something causing this, something specific causing this loss of function. And because it's loss of function, we have to give an anti-sodium. Child is not having cancer or is not having ulcers. You don't have to think of syphilis or you should not think of psychosis. At the same time, there will be a tendency deep inside. It's not flared up yet. It's not shown itself yet. But over a progress of time, it will show itself. And at that time, one miasm can lead into the next miasm. Psoriasis is a skin disease. What is the functional loss in it? Yeah, so the skin is not functioning, isn't it? There is itching, there is discomfort, there is the scales appearing. It's not in its usual function. Skin also has its functions. So when you have psoriasis and scabies interfering with the normal function of the skin, it is a disease after all. Functional loss is just the deviation from the normal healthy state. What it can be any amount. It can be a small amount. It can be a big amount. Okay, you have read that Sora is a non-venereal miasm, the other two are venereal miasms. Can you help me understand? Okay, so very simple. So Sora is because of the skin, the scabies and the psoriasis of the skin. That is the origin. Let's say psoriasis is the ancestor of Sora. Okay, now the other two, psychosis and syphilis, arise from STD, sexually transmitted disease, or venereal diseases. So in those days, these don't exist much anymore because we have better treatment and we have better prevention today, better understanding and better knowledge of these diseases. But I'm talking about 300 years ago when all this was rampant, and gonorrhea and syphilis used to, literally affect anybody and everybody because they didn't have preventive measures like they do today. So when these diseases used to affect the parts, it used to be so deep acting that it will leave a lasting impression, lasting change on the vital force. And then those are accompanied by a certain characteristic set of symptoms that will affect the mind as well as the body, not just of the person suffering, but the generations after that, their children, their grandchildren. So there is some genetic predisposition present because of that psychosis or psychosis or syphilis. It will not show syphilis. So it will not show itself at the time of birth. At the time of birth, everybody is a Sora, a latent Sora. Not even a Sora, a latent Sora. But
Latency.
later in life, a certain type of exposure, certain development of their characteristics will suddenly show that psychosis flaring up or the syphilis flaring up. So that was there. That was somewhere there deep inside. Yeah, that's why some people have heart diseases running in the family. Some people have cancer running in the family, diabetes running in the family. You can't help it. It's genetic. It passes on from generation to generation.
That is why when taking a
So,
family history,
hmm,
when taking a case, family history is very
yes.
important.
Yes, yes. And allergies are also considered to pass on. So you must take a note of allergies, especially skin, respiratory. Okay, next question is, according to totality, patient got one medicine, but antisodic remedy is another. Then what must we do? I'm sorry, I'm not sure I understood the question. What do you mean by patient gets one medicine, but antisodic is another remedy? You have to take what is the what is the simillimum that is indicative after the totality is found. So whatever is similar, don't think too much about the miasm, because when you see the presentation of the patient, the presenting complaints, it will point out to a miasm quite clearly. And for example, lycopodium, they say that lycopodium is one of the greatest antibiotics. Lycopodium, sulfur, or say calcarea carb. There is a lot of functional disturbance, but you will not find these to be indicated for stuff like cancer or ulcers or
Yeah.
you know hepatitis, cirrhosis, things like that. It will be more of uh, functional changes and inflammations. If
In
you can just give
Sora.
me a little bit of clarity on the question, I'm not sure what you mean by that. So to be single in SORA, it is not necessary to have any skin complaint. But if any other organ has any functional loss, then it is SORA. Absolutely right. Absolutely right. Psoriasis was like I said, the ancestor, like how monkeys were our ancestors. So psoriasis is the ancestor of SORA. Okay. So it has evolved into the miasm that is SORA. So that only gave a history, or gave gave Hahnemann a sort of a groundwork for him to build his theory around. So not necessary an antisoric remedy has to be given only for skin complaint. It can be given for any loss of function. Like I said, the lycopodium cases that I had, somebody was having acne, somebody was having renal calculi. Now you'll ask me why renal calculi and antisoric. How is that possible? You should be giving antipsychotic for renal. What happens is, now the renal calculus has developed very acutely. It developed in the last few months in this patient, probably because of what she must have been eating. She is not somebody who has repeated renal calculi. If that happens, then I'll
If
probably have
there
to
is
think of
repeated
another remedy.
renal calculi, it becomes
Yes,
recurrency
yes,
would come
yes.
to the
So
Sora. Yeah.
yeah. So when you start, or when the manifestation first shows itself, we start with a SORA. Unless it is very very gone reversible and there are structural changes and all that, then we think of something else. But then right now the renal calculus is a little superficial. She's not struggling with passing urine or not. She's just having backache. So lycopodium seems to help her. If it doesn't help her, if she's having repeated calculi, or the calculus is so big that it's obstructing her ureters or something, then we'll have to think of some other remedy. Okay, next question. Ma'am, how to handle a case of rabies if it has to be considered as half acute miasm and treat with acute remedy? Or should advise to take vaccine? Unfortunately, you cannot give vaccine once if the person already has rabies, right? Vaccine is more preventive by nature. So rabies is it's unfortunately rabies is difficult to treat, because there are irreversible changes that occur, and what you have to do is you have to really take the case of the patient and treat the person based on the similarity. That's all. Because it's half acute, because there will be some deep changes that occur, especially hydrophobia, that is the fear of water. Sometimes they can have a little bit of mania, they can have that that the what do you call, the symptoms of poisoning can be very clear in them. So what you can do is treat the physical complaints, because we want to bring relief in the patient those 16 days or 15 days, whatever it takes for rabies to run its course and finish off. After that, there will be certain changes in the patient. For example, fear of water. Those things, it's very difficult to reverse, very difficult to treat. At that time, you realize the patient has moved on to the next miasm. So you have to treat that as part of their constitution. As long as they don't have too many physical ailments, it should be under control. But you cannot cure a case of rabies. You can treat a case of rabies. There will be one or two changes inside deep within, which will not change completely. But as long as it's not flaring up, it's not showing itself, it's not disturbing the patient on a daily basis, should be okay. What else? So can I just give an example of a drug? How the miasm can progress in the drug? Okay, one more question. Okay, ma'am, in case if the patient reaches us immediately after being bitten by a rabid dog, how to manage? So you give the drug in a high potency. At that time, you treat it as an acute case. You don't treat it as a half acute or a chronic case. And make sure that the infection is under control. And they have to take, anyway, they have to take the injections, because we cannot kill the organism in homeopathy. So you have to have a little bit of combined therapy. Doesn't every remedy have three miasms? No, not every remedy has three miasms. You cannot, if suppose a patient has progressed from SORA to the next miasm, then you have to change the remedy. You have to give something that is indicated. So sulfur is anti-psoric remedy given in mostly psoric condition. Is it not just psora? It can be given in any skin complaints where there is itching, there is superficial functional changes. Sulfur has a lot of indications where the skin complaints arise from use of topical ointments, using all these medicated soaps. The patient has an aversion to washing. So it's a very superficial thing. You're not consuming the soap, and the soap is not affecting you from within, right? It's not causing any structural or internal changes. So sulfur is purely psoric. How many medicines denoted as like it in antipsoric? Are you talking about classification of drugs based on their miasms? Are you asking that, Amit? Just clarify that, no? If you can tell me. I'll just wait for him to finish writing that question. I mean, clarifying that. Rashmika, do we have a time limit?
No, we don't have any time limit today. We can
Oh, okay.
answer freely all the questions and have a
Very
good
good.
interaction today. I've read in
Very
many
good.
remedies.
All three miasms in background. There are remedies. There are some remedies that have all three miasmatic backgrounds. That's what I was coming to that. So, sulfur is anti-psoric. How is it proved? So, if you see the symptoms of sulfur, when you prove sulfur as a remedy, the patient is under, or the prover is under observation for as long as possible, for the longest possible period of time, and you will find that the symptoms stop only at functional disturbance. You will not find that the patient has developed something else deeper, has not developed any destruction of their organs, or has not got any suddenly developed any overgrowths, warts, tumors. So then you can conclude by saying that yes, this remedy is you know only functional or only dysfunctional in its manifestations. And then you can use the same remedy to treat the same set of symptoms when the patient comes to you. So it's again based on symptoms. It's not based on the disease itself. So you must know your disease classification. You must know your diagnosis, saying that okay, so this specific set of symptoms is indicated for this specific disease. So most of the infectious diseases, acute infections, can be psoric. So whether it is malaria, whether it is typhoid, and even the common cold, these things are all functional. Your patient can recover and patient can come back unless their vital force is so weak that complications occur and they die. So sulfur is anti-psoric. How is it proved? This is how it is done. Now, okay, Yashvi had asked that I have written many remedies that all three miasms are in the background. So yesterday we spoke about Nux vomica. Nux vomica has all three miasms in its background. So that's what I was coming to. We were trying to. It's an example, okay? It's an example. So I'm using this example to understand, for you to understand. Um, Nux vomica, take the course of the patient's life as an example. So let's say the patient is a thin, irritable individual leading a sedentary life. And because of the sedentary life and their busy work life, their busy profession, they're super achievers, very ambitious. They will stop at nothing to be number one and be on top of their game. Such a person wants quick results. They will not bother to stop and worry about other things. So what they do is they don't have the time to sit and have nice full meal. They will just reach out for a burger and fries, or they'll just reach for a samosa or a vada pav, and this happens repeatedly. Or on the weekend, they've said, okay, I have worked so much, I deserve it. I'm the best. I deserve a great meal. He goes out and he eats all sorts of junk. He drinks a lot. And the next day, he's got a hangover. He's got an upset tummy. What is this now? This is a functional disturbance. Okay. Okay. One night of drinking is not going to make you sick for the rest of your life. It is going to make you sick for one night itself. The next morning, he's got a hangover. He will take Nux vomica. He gets better. He's fine. Next weekend, again, the same thing happens. Weekend after that, same thing happens. So let's say for the next 3, 4 years in his life, or next 10 years in his life, he does this. He keeps drinking, he keeps overindulging, he does all these excesses. There comes a point where he spoils his liver. Okay, and there is a deeper inflammation of his liver. So from just having a hangover, he now probably has hepatitis, acute hepatitis. Okay, so now in that also you can give Nux vomica because sedentary life, and he's had a lot of excesses. Give Nux vomica. After a few months, more years of doing the same thing over and over again, he might have cirrhosis. What is this now? This is destruction. So you can see the progress of the disease from it's going from one miasm to another, and you can still use the same remedy. I'm not saying that give the same remedy to the same patient. You have to change the remedy at some point if needed. But what I'm saying is you can still indicate. For example, if a patient came to you 20 years back with a hangover, you could have given Nux vomica. If they come to you today with a sedentary life, which has led them to having cirrhosis after prolonged drinking, that time also you can give Nux vomica. It's just an example. It doesn't have to be the same person and the same indication. But I'm just giving an example. Some remedies can be indicated because of the predisposing condition, because of the what do you call, because of the uh, symptom similarities. In the end of the day, you have to choose totality of symptoms. You have to choose the simillimum, and that's the only thing that will work. Miasms should stay in the back of your mind as the practitioner, but then what you choose is important. What remedy you choose based on similars is what is important.
I think
What
you
is
wonderfully
left-sided and right-sided?
explained the evolution of
Sorry?
miasm. I think you wonderfully explained
Hmm.
evolution of miasm with one simple example with Nux vomica.
Thank
And
God we took Nux
you
vomica
can
yesterday.
identify
I
a
don't know what.
maintaining cause also.
Yeah, so it's only an example. See, you have to just use your own analytical skills and, got the point. Thank you, Yash. We got the point. Should be what is left-sided and right-sided remedies. So this is a slight change of topic. It's not to do with miasms at all. So normally what happens is when you prove a remedy, you choose a whole range of, provers, whether it is young, old, female, male, and you try to see the common symptoms that might occur in all of them. So, for example, if you choose to prove, say, lycopodium in all these 200 patients, if, say, 50 or 100 of them show complaints on the right side, then we can conclude that this remedy has a certain affinity to the side. Sometimes also, like in the case of Lyco, it is a liver remedy. Liver is on the right side. So it can be both ways. Say that because it's right-sided, it'll affect the liver, or because it has affected liver, it's a right-sided remedy. You can say both ways. But provings, majority of provings, if they show a particular affinity, you can conclude saying that it's a left-sided or a right-sided remedy. But that doesn't mean that you cannot give it for the opposite side. If the other symptoms and other similars are indicated, you can still give it. Like I had a patient with left-sided sciatica, but everything else suited their the symptoms suited Lyco. So it worked pretty well on her. It still showed her a lot of relief. Can you repeat about half acute miasm? Okay. So Sujata, are you back online? Yeah. Can you put half acute miasm?
I'll move on.
Yeah, she's back on. She lost connection in
Oh, great.
between. She's back.
Yeah,
Hmm.
she told me that she was having few connection issues.
Yeah. Yeah. So this is not that relevant. This is just information. If at all you have to learn this for your exams, you have to. But don't worry too much about half acute miasm and acute miasms and all. Our main concern is the chronic miasms. Okay. So half acute miasm is miasm has taken effect in the moment the person is bitten by a mad dog. So we've got the example of rabies or hydrophobia. Hydrophobium is the remedy given for it. That's the example. So poison has communicated itself to the nearest nerves, and as soon as the malady has been developed in the whole organism, for this development and completion of disease, nature requires at least several days, often many weeks. The madness breaks out as an acute, quickly fatal disease. So what happens is it's acute because it's just a bite of a dog. It's not something that has taken years and years for it to manifest. One quick bite of the dog, and the organism has entered your body. But then for the full manifestation or full expression of the disease, it takes a few weeks for the organism to go and run its life cycle, and then show the symptoms. So the cause itself is acute, but the manifestation is not so acute. It takes some time. That's why it's called half acute. You get what I'm saying? Can we have the first two slides, Sujata, please? I
Which
think they
first two
missed out on that.
slides? The
First two
introduction,
slides of introduction. Let's
yeah,
see.
the origin, and yeah, this is the first one.
Hmm. Okay, I won't read what's written. I'll just tell you that Hahnemann was okay, no problem. I'll just give you a short history. So what happened? Why did we come down to this whole conclusion or whole concept of miasms? Hahnemann was practicing at a time when we had no idea of pathogens, we had no idea of bacteria, viruses, microscopes. Microscopes were there, but then we had no idea that this is what was causing diseases in the body. Okay, they had some vomiting, diarrhea. That's why he was so concerned about the symptoms. But he had the foresight, he had the sense to think that, okay, there is something inside, something deep that is causing these problems in the body, which is why the patient is falling sick recurrently. So
Everyone.
he treated, yeah, especially non-venereal. Now they knew venereal disease, why it was being caused, obviously through contact, through sexual contact. So
Yeah.
non-venereal chronic diseases, and they had no idea about lifestyle diseases like diabetes or hypertension or cholesterol or allergies, autoimmune disease. They had nothing of that sort back then. I'm talking about late 1700s. And Louis Pasteur was considered the father of discovering pathogens with the help of microscope and with all his research. And this was in 1860. I just checked on Google, it is 1860. Hahnemann died in 1840. So so many years before Louis Pasteur, Hahnemann came up with this theory that there is something present in the body, something deep, which is causing these diseases to occur and all these severe manifestations. So then he said, let's call it miasm or miasma, which means, noxious fumes or bad air. So the word malaria comes from mal air. Mal means bad or polluted or toxic. So there's something, maybe he assumed maybe there's something in the air, we're surrounded by air. So something in the air which is entering us and causing that disease. He could not conclude, but then he set the groundwork. And probably the other doctors and other scientists, they built up on that theory then and came to the conclusion that there is some microorganisms. And see, if you see syphilis and sora also, I mean, syphilis and psychosis also, they are infectious. So infection always has to spread through a germ or a pathogen. It's not through an allergy or through a response by the body. Okay, that's what the first two slides are about. It's a small history on why Hahnemann thought of something called miasms as a concept.
And it was not like
So good.
a one day
Huh.
process or one day insight. It
Yeah.
took him nearly 12 years to build
Yes.
a theory called
Yes.
doctrine of chronic miasms.
Yes.
Any
Because
other
it
question?
takes a long time. No? They have to see so many patients to understand the repeated complaints that come to them. It's not just one. Okay. I'm just
Yeah.
going to share one link with all of you. Just have a look. You can save this link. Just 1 second. Sorry. I
Yeah.
didn't get, yeah. So this is about chronic diseases written by Hahnemann himself. Just have a look at this. You can all copy this link and read it in your spare time later. So he says SORA is the oldest miasmatic chronic disease known to us, just as tedious as syphilis and psychosis, and therefore not to be extinguished before the last breath of the longest human life, unless it is thoroughly cured, since not even the most robust constitution is able to destroy and extinguish it by its own proper strength. SORA, or the itch disease, is beside this the oldest and most hydra-headed of all chronic. Hydra-headed. Hydra is a mythical, like it's an imaginary monster. It's supposed to have many heads. So Sora has many heads because it can affect, because it's functional disturbance. It can affect any organ, every organ. It can be like a syndrome also. It can be multi-systemic. And you know, it is always there. It's never going to leave you. It is present at the root. That's why he's calling it a hydra-headed monster, because it can manifest itself in many ways. So have a look at this article, read the site in your spare time, copy this link, and it's very nice what Hahnemann himself has written. Don't get perturbed by the language. It's not difficult. It's just that you have to break up the sentences, write it down as points. Yes. Any other doubts? Any other questions? We'll do Sora itself next week. All of you just read a little bit about Sora and come.
Yeah.
We'll deal with it in detail, its history, its progress, and what are the remedies that come under Sora. How do we differentiate these remedies? How do we tell them apart? The three great antisoric remedies, calcarea, carb, sulfur, lycopodium, how do we tell them apart? I'd mentioned it a little bit in lycopodium, but we'll do it again. And we'll do it with miasms as the background so that, you'll be able to use it. Read a little bit and come so that you all can come equipped with all your questions and doubts. It's very interesting. So when you see the origin and the source of the remedy and the doctrine of signature, and then you take miasms, let's connect the two and study it next time. Somebody's typing something. Let me wait and see what they're writing. So I hope this was clear to all of you, at least some of it. A lot of today's presentation is just history, so don't get too upset or don't get too disturbed by it. Uh, it may not be applied in your daily practice, but then you will have to know a little bit about the history for you to understand. Thank you very much, Vidya. Very happy you found it a wonderful session.
Thank you.
So yeah, it's like an exam for us also, no, like a revision. We're talking
Now
about the drug.
about the drug.
Which drug?
Which
I'm
drug?
talking about drugs that can match the miasms that we are going to discuss from next week. So, if you're doing SORA, what all drugs come under the anti-psoric indications? Yeah, thank you so much. So, always remember to write to us if you have any further questions, sharing my email ID. I'm also excited for next week's
Excited
session.
for the next session. Everyone is.
I did. I feel like this is like one, show that we are having. So next episode, next episode. So the trailer for next episode is Sora. Maza aa gaya. Very good. Thank you. Surabhi, you've asked us a lot of questions. You've kept us on our toes, but I'm very happy you did that because
Yeah, it was a
the
wonderful
first,
interactive session. That such
yeah, yeah,
interactions would
yeah,
make our sessions more
yeah,
happy and
yeah.
interactive.
Yes, and
I
don't get scared
published.
of this topic of myself because it occurs in organ medicine, chronic diseases, Kent's philosophy, Stuart Close. How about everybody talks about miasms? Everybody wants to ask miasms in your exam, but don't get upset or don't get disturbed. It's a very simple topic. There are two, three very fundamental characteristics of each miasm. Once you understand that, you can build up your answer based on that. Okay, it's very simple. If you understand dysfunction, excesses, and destruction, then you can build your entire answer. You can come up with complaints that are connected to these miasms. So then there is nothing to get worried about or nothing to get all confused about. Don't think of SORA as psoriasis. Psoriasis is just a part of SORA. SORA is a miasm. And don't confuse psoric and antisoric. Psoric is the miasm. Antisoric is the remedy you choose to
Them.
treat the psoric. Yeah. So don't confuse the two. It's very simple. Antisoric is the remedy. So lycopodium is an antisoric. Psoric is the miasm. Okay. Surbhi Singhal, I hope you come next week and ask all your questions then. It's quite
Exam
nice to answer all
oriented
your
and
questions.
which book should we
Which
use?
book should be used? Okay. So, Organon of Medicine, luckily, I don't think you're asked to name the aphorisms and all in your exams. So, read good book, a guide. I think, see, when I was in college, BK Sarkar was pretty popular because the language is easy and he also writes it pretty well. He combines a lot of aphorisms together, merges the topic. And Kent's philosophy, Herbert Roberts, Stuart Close, these books are
Yes.
really good. Yeah, these
I
books are
think
very good.
fourth year
The
is
language is not difficult.
in fourth year
Huh.
it's a separate paper with Kent and
Hmm.
all the three philosophy
Yes,
books.
yes. All three books on philosophy. Don't get worried or don't get upset about the language. Just make your own notes. Just write it in
No.
bulletin form. So,
Yes.
like classification of diseases, I presented one table to all of you. So, from there, it's easy for you to build up your answer from that. So, write your own notes, make your own points, and don't sit and get bugged by the long paragraphs and all that. Just get the gist or just get the essence of the matter from the paragraphs that they're written. Stuart Close is a little bit more detailed. I think you need some more patience to read Stuart Close. You have 5 philosophy books, but the ones that I'm saying are 200-year-old books. I mean, those don't change, they remain the same. So do
Just
read
not
those
good
books. Kent's
books.
philosophy is very nice. Kent and Herbert Roberts, very easy to understand. Stuart Close is a little bit more difficult, but it's okay. You can, if you have the patience.
Versions.
Mentioned clinical interpretation of mice in patients. So then the patients, I have to do it with examples when we have, say, a set of symptoms that the patient comes with. If you want, I'll take a couple of my own cases and I'll tell you, or any cases I've seen in the past. And we use the symptoms to interpret the miasm. So we must understand the miasm's interpretation. We must understand the case of the patient itself, and we're going to combine the two and say that this is that miasm. Okay, don't get worried. I mean, you'll see enough patients in your practice to be able to understand what miasm. And one thing you have to unfortunately remember or by heart is which remedy corresponds to which miasm.
Which means
So next week, just one more thing. See, the oxygenoid, what is it, hydrogenoid and carbonitrogenoid. These are the three. Von Rogel mentions this classification. So we will try to correlate that with our miasms. Once you understand that, it's going to be very easy to understand, remember. Very easy to remember. Okay. So don't get confused. Next week is Sora. So come prepared with a little bit of background reading. It's not a Viva, so it's just so that you don't feel lost. Okay.
yes.
I will share some of my cases. Whatever is relevant, I will share a bit. But we will help you understand and relate the miasms with the symptoms of the patient. But don't get too worked up. Like in the clinic, you're not going to be sitting and thinking, this one is Sora, that one is syphilis. You'll be thinking of only the symptom similarity. And that is what is important. So if the patient comes with a certain set of symptoms, try to think of the drug that can be connected to that. Don't sit and worry about the miasms. You don't have to think about, okay, this patient's great grandfather had psychosis, gonorrhea, and all that. That's not going to be what's in your mind. You're going to be thinking of what remedy is connected to this one. One webinar on constitutions.
I
So we are doing Materia Medica lectures itself. We are doing one drug each week. So in that, we are dealing with constitutions here. Every Wednesday, we have a webinar on Materia Medica. So we have finished Lycopodium, we have finished Nux vomica yesterday. Next week, we are having Cilicia. So we will cover each constitution based on these remedies that we select. Unless you want a special class only on how to select a constitution, but that's not very detailed. It's only doctrine of signature. Miasmatic analysis of a case. We will do that with each miasm. Okay, we do that with each miasm. So the progress of each miasm, first you have to understand how the miasm developed. Second is you have to understand what the manifestations are. Third is how do you apply it in your clinical, in your case taking. Fourth is how you select a remedy based on miasms. Four things, okay? Four things. So next class onwards, we are going to deal with SORA and we're going to cover these four things of SORA. Same way with psychosis, same way with syphilis. And it is in this order: SORA, psychosis, syphilis. Because destruction is the last thing that happens before a patient dies. Okay, all of you. So let's see you all next Thursday for Sora, and the next session is going to be quite exciting. We're going to deal with it in detail. If that is all, we'd like to close today's session. And yeah, all right. Thank you so much. So come with your doubts, come with your queries, and we'll deal with this in detail next Thursday. If that is all, I'd like to close today's session. And good night and see you all. We'll upload the recording soon. Just be patient with us. I think we just have to wait for uh, our team to just upload the videos on the website. As always, if anybody has any questions, any doubts, just email it to me. All right. See you all. And good night. Signing off.